The most common reason is actually concern over why they're having a headache, or patients are concerned that there's something going on that's not a typical migraine, that they might have a bleed in the brain or an infection in the brain. So they want to be checked out by doctors and make sure they don't need any imaging or further workup. Another common reason that patients go to the emergency room with migraine is that the headache has just gotten so severe and difficult to treat at home that they need to be treated in the emergency room. Interestingly, there was a study done looking at specifically why patients go to the emergency room at Montefiore, where I work in the Bronx, and this study found that by far and away patients were going because they were concerned about the type of headache they were having. Though it's interesting because over 80% of the patients reported that the current headache they were having was similar to headaches they'd had in the past. So many of these patients had a diagnosis of migraine, yet they were going in for similar types of headaches. And this points to an area where we can potentially improve education of patients and reassurance for when they don't need to be concerned and when they should be concerned in going to the emergency room, such as if they have any new characteristics, new neurologic symptoms, vision changes, speech changes, things like that. It could potentially prevent a lot of emergency room visits, unnecessary emergency room visits. And the study also found that the average length of the headache was 24 hours before the patients went to the emergency room, which is a long time, but it means that some patients were going who had only had a headache for a few hours. And also, over half the patients had not taken an acute medication on the day they went to the emergency room. Again, pointing to an area where we could potentially improve care of patients and prevent emergency room visits if we gave them a better plan of attack. And so medication to take when they get the headache and even backup medications to take. So I think we could potentially lower the amount of people who are going to the emergency room if you know exactly when to be concerned and what medications you can take before it gets so bad that you have to visit the emergency room. Yeah, so the emergency room can be a really challenging place for a patient with a migraine, especially someone who's having a severe migraine that's prompted them to go to the emergency room in the first place. So an emergency room is very loud and noisy. There's machines going off, there's patients coming in and out, there's a lot of doctors and staff. So for a patient who's very sensitive to sounds, that's obviously going to bother them a lot. Similarly, there's bright fluorescent lights. It can be hard to find a quiet, dark area to rest and recuperate, which is really critical in a patient having a severe migraine. They need sleep, they need rest. So the environment is just awful for patients having a migraine. Another challenge or potential challenge is that when you're presenting to the emergency room with any complaint, you're going to get a pretty big workup typically, and a lot of patients coming in with migraine or headache end up getting a CAT scan of the head. And in some cases this is certainly warranted if there's any concern about an emergent condition or something else dangerous going on. But they're finding that over half of these patients are getting scanned, are getting head CTs, whereas 95% or so of those head CTs are negative or normal. So there are probably a lot of cases where they're erring on the side of getting imaging and where it might not be completely necessary and where it might be exposing patients to unnecessary radiation. So just to know that there is a higher chance of getting head imaging, specifically a CAT scan, which may or may not be necessary. And then the last issue, which is a big issue, is that you're seeing new doctors who don't know you, don't know your medical history and the types of treatments that work best for you. So this can be challenging, and it might lead to them trying medications that aren't quite as effective and really not getting the best possible care because you're not being seen by your usual doctors. And specifically, emergency room doctors often prescribe opioids or narcotics. This is the most commonly prescribed medication for headache in the emergency room, and these medications are not the best for migraine by any means. They're actually not as effective. They're not as specific to, and targeted to migraine. And they have other risks associated with them. They can cause sedation. They can make it more difficult for triptans to work well for the migraine. There are other issues as well. So you're putting yourself in the hands of these doctors who are not as used to treating migraine and treat them a little bit differently than neurologists would recommend. There's a lot that can be done, and I talked a little bit about the first step, I think, is proper counseling of patients of when to go to the emergency room in the first place. Really having a plan in place with your doctor as a migraine patient of when should I be concerned enough to go to the emergency room, and what medications can I take to prevent going to the emergency room. I think that's the first step. Of course, trying to improve the environment as much as possible for a migraine patient. This is sometimes difficult given space, restraints, and just the flow of an emergency room, but as much as possible, trying to have migraine patients in their own room, minimizing the amount of vital checks if they don't need vitals checked so often, and lab draws and things like that. Trying to really minimize those bothersome external stimulation like bright lights, loud sounds. That can be very helpful as well. And I think education of emergency room physicians as much as possible about the best treatment for migraines and what the current guidelines are for medications used in the emergency room is also critical for improving care of migraine patients in the emergency room. Yeah, that's very important, and I think it goes again to the emergency room physicians getting good teaching or exposure to the guidelines. But first off, they should really be focusing on, is this headache a new headache or an old headache? So if it's an old headache, meaning that the patient has had a similar headache in the past, that's more reassuring. And if a patient's had a long history of migraines and this is a similar headache, they probably don't need head imaging, and they should really be focusing on treatment and getting that patient better from the migraine standpoint. If it's a new headache, though, if there's anything different, that is certainly concerning. If it's come on very suddenly, or if there are any new features, then that might prompt them to do more workup. So that's a really important question, first off, that should be assessed. Second, there should be a focus on the treatment. So the emergency room physician should really ask, what treatments have you tried in the past? Have you ever been in this situation before? And what's worked for you? I'll get into this a little bit later, but often patients have been to the emergency room with migraine and they've gotten a certain cocktail or a combination of medications. And emergency room physician should really ask the patient first and foremost, what's worked for you, before just trying random medications that may or may not work. So that's another important question they should be asking. I think the biggest piece of advice is know your migraines and know which treatments have worked for you in the past, especially if you've been to the emergency room before. It can be very helpful to come up with your doctor, with the help of a doctor, either your primary care doctor or your neurologist, to come up with a plan of attack for what you should do the next time you go to the emergency room. And often we advise patients to even type up or write up a piece of paper, have a letter signed by their neurologist with this treatment plan. We're happy as headache specialists, as neurologists, to write you a letter and say, these are the medications that work for this patient. They have a diagnosis of chronic migraine, and this can be really helpful in that acute situation where there's so much going on, you're in a lot of pain, you might be vomiting, it's hard to think straight. So if you already have it all written out on a piece of paper, you can just show it to the emergency room physician and say, this is the order of medications that work well for me. And a lot of patients have told us that they really appreciate having that, and that made the whole process a lot smoother. Patients should really know when to go to the emergency room in the first place, and know that if they're having a similar headache to their migraine, even if it's a little bit more severe or if it's in a different location, they don't necessarily have to jump to going to the emergency room, and that in many cases that can actually worsen the headache. So to know when is the appropriate time to be concerned. And then also really wanted to emphasize for patients having that plan of attack, that treatment plan with you when you go to the emergency room is critical, and really can be really helpful to have a piece of paper writing out your treatment plan and your doctor's recommendations.